Hi, my name is Melissa Christensen and I'm a cancer survivor. I tell patients all the time, it's a club you never want to be a part of, but if you are a part of it, you're dang proud that you're part of it. Because you have to fight day and night, and you have to fight so hard just to survive, to get through, sometimes minute by minute, sometimes hour by hour, to get through that time in your life. And it shapes who you are as a human. It shapes how you look at other people. It shaped what I do for a living right now, which is exactly what I would want to do. I wouldn't want to do anything else but be an oncology nurse. Yeah, so my symptoms actually were kind of odd. I was actually getting ready to start my sophomore year of high school, and I fell down some stairs and I broke my toe, started having weird numbness in my foot, random leg aches at night, and so we were trying to search and trying to figure out why all this stuff was happening with this numbness and leg aches. And I was also training to be on the girls basketball team. Got home from working out one night and got out of the shower and felt a random lump in my leg, and I was like, oh, I must have worked out harder than I thought. Well, I happened to have an appointment with an orthopedic the next day. I showed it to him and he immediately freaked out, did x-rays, and I was in surgery about 3 days later. When they did the surgery, they actually removed a tumor that was the size of 6 eggs that had also wrapped itself around my nerve. So they ended up going back in later and removing the nerve as well. And it was determined after pathology came back that I had a type of cancer that was incredibly rare called neurofibrosarcoma. It required aggressive chemotherapy, inpatient for about up to a week at a time in hospital, getting 6 different medications. And then after that, I had radiation as well. So support system is vital, especially going through cancer treatment. It really changes your perspective on life. It changes how you get through day to day. There's days that you're not able to even fully bathe yourself. But the support system is not just for the physical things that you can or can't do while doing treatment. That emotional support system, there's definitely trauma response that happens when you get diagnosed with cancer. And, it not only does it happen to you, but it happens to your loved ones and your friends and your family. And so, having people who maybe aren't going through exactly what you're going through, but they're living it with you, it's vital in getting through the process. The nursing staff truly is what got me through the chemotherapy treatments in the hospital, because they spoiled me, to be honest. They turned into my moms, my dads, my grandmas, my aunts, my best friends, and which is honestly and why I became a nurse, is to become an oncology nurse. So I think one of the biggest things that family and friends don't really fully comprehend when they have a loved one going through cancer is that trauma response. It's just someone comes home from war and they have that trauma that they've lived through and whatever, or someone who's been assaulted in some way, getting diagnosed with cancer and having to go through that treatment and literally not knowing if you're going to live or die, it creates a similar response. And so I think it's oftentimes not thought about, because so often with cancer treatment, and it's just people focus on the physical symptoms, the outward symptoms that they can see, the nausea, the vomiting, the hair loss, those kinds of things. And so that's what they focus on, that's what they think you need help with. But a lot of times it's more that psychological and an emotional aspect that you need help with as a cancer patient. I think one of the best ways that you can support a loved one that's going through cancer diagnosis and treatment is just be there. It doesn't have to be grandiose things. It doesn't have to be gifts and food and whatever. But if they're too tired to go for a drive or to go to the movies or whatever, just sit next to them on the couch and watch a movie, or send them a text that you're thinking of them, or hey, I'm gonna come sweep your floor, or just those little things that people don't think of. I think is a huge way that people can support. I'm Melissa Christensen, and I work for Utah Hematology Oncology, Ogden Clinic, and I'm a registered nurse team lead. So far, I am cancer-free for 25 years. So.